Hi, this is Megan Tarvis, and this is my reflection on mental health and substance abuse disorders for this week. After reading the material on this week, most of it was a review from previous courses and as seen in practice working as a nurse. But I was surprised to see that there was no material regarding postpartum depression in the mental health chapter, as this is a major impact regarding the women's health population. Postpartum depression is a huge topic, and it was not mentioned or found in any of the material for this week. One thing I found interesting was the pathophysiology included, obviously, in mental health disorders, which is important because sometimes, like, for example, depression, many may think depression is an emotion, but there's an actual pathophysiology behind the balance of neurotransmitters in the brain. Things that did not surprise me was the rates of substance abuse disorders remains high, as it's seen in healthcare and everyone's practice. Reading the differences in mechanisms of substances surprised me because I'm not familiar with some of the mechanisms, so that's good to know for future practice, which substances cause which effect to patients and how they act or withdraw from substances. I was not surprised to read about the systemic effects in the body when using substances or combining with alcohol or overdosing. So 3 things I learned about substance abuse disorders. One is regarding withdrawal symptoms. They range from mild to severe, which I know, but how the body cells are adapted to the drug use, for example. So if a drug is well adapted to cocaine, basically that's based on how they're going to withdraw is based on how severe it might be. It could be more severe than mild. Anti-anxiety medications use of alcohol doesn't cause respiratory depression, but it damages the brain instead. As many substances cause respiratory depression that results in ultimate death. Anti-anxiety medications combined with alcohol does not. And one other interesting thing I learned, which will help me in my future practice, is the use of cocaine during pregnancy. This mechanism will elevate the blood pressure. I have patients that come in all the time, not all the time, but patients that do come in using cocaine go into preterm labor. And the reason is I learned the elevated blood pressure and the placenta doesn't get enough blood flow, causing the preterm labor. 3 things I learned about mental health disorders. The pathophysiology of depression involves there is a pathophysiology of depression, as I mentioned earlier, and it's not an emotion or feeling you're feeling. It's actually involving activity of excitatory neurotransmitters within the brain. Basically decrease like neurotransmitters, like norepinephrine. The goal of treating depression with drugs is to increase that norepinephrine in the brain to avoid any depression episodes, thoughts, feelings. And the pathophysiology of panic attacks, that it's not just an onset, but it's another pathophysiology involving discharge of neurons. It's kind of similar to like seizure. It's an increased upcharge of neurons in the brain that produces fear, anxiety, feelings of discomfort, whereas seizures is that constant discharge of neurons firing, which can cause seizures. So I found that learned that mechanism is kind of similar. And how I implement this into practice, basically, I am in the Women's Health Nurse Practitioner program. So I currently work in a women's health triage where I have experience with these patients with postpartum depression, schizophrenia, patients with substance abuse disorders. So knowing the information I know, I can take that as more of a preventative, implement more preventative in providing resources for these patients who are at risk, rather than right now working in ED treating those patients when they come to an emergency room. We can provide programs, resources, implementation techniques to provide outpatient, identifying these patients who are at risk to prevent preterm labor and prevent them from coming to the ED for emergency situations. Again, with postpartum depression, you want to make sure the goal is to appropriately screen and treat these women to prevent fatal outcomes, making sure they're on the right medication, referring them to supportive services, and appropriate screening, like I mentioned, that is very important. So these are two important topics that will highly relates to my area of practice with substance abuse and mental health. So I will definitely implement and take this information in my further practice. And that is my presentation. Thank you for watching.